This is Laura Vredeveld from TBD Solutions, and with me is Josh Hagedorn, also from TBD Solutions. And we are going to, this is the second in a series of kind of lunchtime webinars that we're giving to address some of the issues that we're finding in the implementation of data analytics in organizations. So last time we got together, Josh talked a lot about measurement frameworks and developing metrics and what are some of the national frameworks for metrics development. And today we're going to take a step even farther back at maybe a higher level, but we will make it practical at the end. And we're going to address some things that we find when we're talking to folks in data analysis roles, people working on committees, people trying to make good decisions in their organization. And we're going to talk through today some of the biases that we all bring with us when we address questions and answers and making good decisions in our organization. And we're going to talk through a framework that helps us ask better questions that lead to better answers for our organization.
So let's get started just by looking at some of, and really this is sort of the common issue that underlies much of what we're going to be talking about today, which is to say biases that are built into how we think on a day-to-day basis. One of the things that we're assuming here, and this is probably not even worth putting on a slide, but nonetheless, here it is on a slide, and that is to say that if we're going to ask a question, asking a question assumes that we have an imperfect knowledge of the way that things are, that we have something that we can learn and that we don't know it all already, right? For anybody who does not need to learn anything, I'm assuming that you're not on this call, and that all those people who have nothing to learn are enjoying their lunch somewhere without listening to this webinar. For the rest of us, mere mortals, we are, this is sort of the situation that we find ourselves in, and a lot of times we're making decisions based on half-facts, and we're making decisions that are they're good enough, and we think they're the best that we can do, and then we sort of rationalize them when we look back on them in hindsight. We also, once we're looking back on them in hindsight, and we've sat with our own ideas for a while, we tend to think that our own ideas they make a lot more sense than other people's. After all, we've been sitting with them for a long time, so they get to be familiar. And we end up, criticizing other people's ideas a little bit more harshly and just having a bent toward favoring ideas that are familiar to us. So with these habits that are just built into the way that human beings think, how are we supposed to learn things? How are we supposed to, even more, build a learning behavioral healthcare system with multiple people in multiple roles? So that's just sort of what we're faced with at the outset, which is how do we get over these biases that are built into the way that we think?
And you'll recognize as we talk through these, I think you'll learn to recognize some of these biases from some of the language that we all use. So we all say things like, I think we're busier than we used to be. It seems like we're a lot busier than we used to be. Or, I'm pretty sure we stopped doing X a while ago. And it's kind of, you'll hear the language like, I think so, I'm pretty sure, it feels like. And that might be a good trigger for you to think about maybe we're operating out of some of these biases that we're going to talk about. So part of what we want to do for you today is kind of tune your minds and your ears into when you hear this in a meeting and think, oh wait, I have some questions that I could ask, or I could offer a framework for thinking through this problem that we're talking about that might actually help us make a better decision about this.
Yeah, sort of a clear tell, I think, that I hear a lot of times in talking to people is when somebody asks a question that starts with the words, how much, and a person answers them with a lot, or more, where it's clearly not based on any sort of gathering of data or evidence. It's based on a perception that the person has about an amount. And those perceptions are just notoriously unreliable for multiple reasons, some of which we'll discuss. So there are, if you Googled cognitive bias, or went to the Wikipedia site, you could find hundreds of different types of biases. We're really going to be looking at a few clusters of different types of biases that are pretty common in decision-making in organizations. And the first one has to do with biases of familiarity. We are sort of wired, for understandable reasons, to protect our view of the world. When something challenges our view of the world, for those of you psychologists out there, we run into a little something called cognitive dissonance, which means that our mind is like literally in pain because we're trying to balance two things that we know are in conflict with each other. So we really do have this incentive to protect our view of the world, and we have a number of biases that try to protect that worldview. A few of them are listed here. So we have confirmation bias, which is we tend to interpret events as confirmation that we were correct and not to look at the ways in which we were not correct. So there's actually an example, a couple of bullet points down, where we say, like, all right, if I made a business decision and it resulted in success, that will be I'll attribute that to my good decision making. Whereas if it resulted in failure, I'll attribute that either to bad luck or to some other uncontrollable circumstance in the environment.
And I think we all recognize, those of you who are clinicians or are working in this field, but even just people who live life, we all do this every day. So if I form an opinion about someone based on maybe one statement they made, and I think Josh is really just a selfish guy, and I form that opinion, what I do then is I just look for evidence to support my opinion. And I really am able to overlook maybe some other evidence that would suggest he's actually very generous and thoughtful of others. And this has been proven again and again in social sciences about how we just look for those confirming facts and disregard things that might force us to reevaluate our opinions about people. And that's also true of business decisions and systems level decisions.
Yeah, absolutely. Another thing that we run into is habits. Everybody has them, and we have habits in our thinking as well. We tend to sort of retreat to ways of thinking that are comfortable for us, places where we've had successes in the past, and a lot of times we'll end up solving a problem that we know how to solve, and not the actual problem that's sitting in front of us. And this is a place where articulating a question well for measurement is really critical, because it helps us to sort of wrap our arms around the real problem that's sitting in front of us instead of the one that we have encountered before and which might be easier to tackle.
An example of that I'm familiar with is working for an organization who knew how to reorganize. And reorganizing was kind of the solution to any issues that they felt were existing with productivity or employee satisfaction or any number of issues. The first thing they would go to do is to reorganize, rather than questioning whether the problem was actually with organization and supervision and things like that. It was kind of a one-size-fits-all solution rather than really investigating the root cause of a problem.
Yeah. And we also, this solving the problem that we know how to solve, it really fits into a core way that we sort of twist information when it comes to us, right? Most problems that we encounter on a day-to-day basis are very complicated. Real life sort of tends to be that way. It has that way of being complicated. And in order to make decisions, a lot of times our minds, without even us thinking about them, simplify the real complicated nature of the world. And instead of us actually processing what is a very complicated situation, we sort of convert it into a much easier question. So let's say that somebody asks, if we ask ourselves, how satisfied are we with the way that our lives are going right now, with our circumstances? Many times we'll actually substitute that very complicated question with another question, which is, what is my mood right now? Mm-hmm. And this happens all the time without us even noticing it. And you can imagine how all of this builds up, especially when you're coordinating something with multiple other people across a team, where all of these habits sort of build up across the entire team, and they lead to a really complicated situation. The other, or one of the two other major groups of biases that we encounter pretty commonly are illusions of thought. And there are a few of these, and we'll run through them and then we'll look at some examples. The first one stands for, so this in large part is drawn from a wonderful book that all of you should run out and buy. I have no financial interest in the purchase of this book, but it's great. It's by he's actually a psychologist who won the Nobel Prize in economics. His name's Daniel Kahneman, and he wrote this wonderful book called Thinking Fast and Slow, based on really 30 years of research that he and his research partner did. So the WYSIATI, that first one up there, it stands for what you see is all there is. And what that's really pointing to is when we tell a story, when we look at a situation, our mind tries to construct a story. And a story doesn't have to be complete for our minds to accept it, but it does have to be consistent. So even though when we look at the actual facts, a lot of times there are inconsistencies, our minds will often sort of sweep those inconsistencies under the rug and just grab things that are consistent in order to create a picture. Also, we are sort of just notoriously bad at dealing with complexity and uncertainty, which is really why we have computers in many cases, right? Our minds aren't built for doing complex mathematical equations, and yet a computer can do one in a fraction of a second. So our minds aren't built for sort of doing those sorts of calculations. We also fall into traps of relative thinking and also automatic associations. So let's just look at a couple of examples of these to make it a little bit more tangible. So for anchoring, so this is a type of relative thinking that we are all prone to. So if we look at the questions, was Gandhi more or less than 144 when he died? And then subsequently, we ask the question, how old was he? So Laura, was Gandhi more or less than 144 when he died?
I believe he was less than 144.
How old was he?
I'm guessing 56.
You just broke the bank, Laura. So most people don't respond that way, and I think Laura is messing with me. So what actually happens in the research when people are asked these two questions in a row, their second answer will tend to be higher when the first number that's listed is higher, even though the number 144 is really is preposterous, right? Like, he obviously was not 144 when he died, but people's answer to the second question will be anchored based on the number that's given in the first, for most people.
I just knew you were trying to trick me.
So,
or I'm a follower of Gandhi. There could be multiple reasons why I answered the way I did.
That's true. There is a small percentage of the population who knows exactly how old Gandhi was, and this doesn't work on them. So next is the availability bias. So an example of this is there's a study done where spouses were both asked about their personal contribution to the cleaning of the house, right? So, one spouse was asked, the other spouse was asked, and when you took the percentage that they both said that they contributed to house cleaning, those percentages, not surprisingly, added up to more than 100%. Now, you might think that that's because they're giving themselves more credit than is due, and they have a sort of inflated sense of how good they are, but they actually gave themselves more blame for causing arguments in the house as well. So what this means is, this is really not due to an inflated sense of self-performance. It's just that I'm much more aware of what I do than what others do because I live behind my own eyeballs, which essentially just, that sort of, in short, is what the availability bias is.
So another example that Josh and I were talking about that I think a lot of people would recognize related to availability bias is when I bought a new car. We bought a Mazda CX-5. And I really had never been aware of this vehicle on the road before. It's not something I paid any attention to. It didn't necessarily catch my eye until I purchased this vehicle. Suddenly, everywhere I went, I was very aware of this vehicle and how many there were on the road. it doesn't mean that suddenly there were more people driving this particular car. It was that now I had a context. It related to me. And my world really does revolve around me. So suddenly I'm in a vehicle and I'm aware of everyone else like me, which is my point of reference, and I see the world in a new way.
Yeah, and now all of you will get to experience the availability bias, because now that you know about it, you'll see it at work everywhere,
Right.
which, ironically, is exactly the definition of the availability bias.
Mm-hmm.
So lastly, and this is sort of the perfect quote for anybody who's ever constructed an annual report for a board, is this sort of feedback that, people didn't want more information that would spoil the story. We want to sort of, keep the metrics sort of to a minimum and make sure that the stories take center stage.
And sometimes we'll go so far as saying, like, well, that particular data can't be trusted because it doesn't fit my story.
Right.
Now, clearly we believe and trust all of the data that does fit our story, so that we are so confident in that data, and as soon as we see something that doesn't fit, you'll hear people say things like, well, that data must be bad. It just doesn't fit. It doesn't make sense to me. I can't explain that part of it. Therefore, I'll disregard it. Or maybe put a small asterisk with something, like we might recognize that there's data that doesn't fit, but we really don't work hard at trying to incorporate it into our story.
Yeah, absolutely. So, a little bit of consolation for anybody who wants sort of some consolation that there are times to trust your gut. So we went through and sort of, there are times really, according to the literature even, where it's fine to trust your gut, where it makes the most sense to do that. But it really boils down to these three sorts of situations. And there are asterisks, not literally, but I'll be talking about exceptions to all of these. So when you have to rely on facial expressions alone, like where you don't have recourse to other information, you just have to figure out whether to trust someone based on their physical posture in front of you when you just meet them, that is a time when your gut is really well tuned to make that sort of a decision. Like it is honed to respond to the ways in which people interact with each other. Also, when you've had the opportunity to learn from a whole lot of similar situations, your gut tends to be pretty accurate. And the interesting thing here is that it's not that your gut is accurate, just, that it's you sort of, came forth into the world ready to answer these. But what's really at issue here is that expertise really comes from experiencing feedback from the same situation or the same sort of situation multiple times. And this is why a doctor with 30 years experience, having seen clients every day for 30 years, can immediately zoom in on the most salient and important aspects of a case. It's not because of it's not because of a degree, it's not because of any sort of magic, it's because of repeated exposure to experience and feedback from experience.
Mm-hmm. So typically these experiences, and I think we wanted to put this slide in because folks sometimes do have a great deal of experience in a clinical setting and an adrenaline-filled setting and lots of those settings where you do have to learn to trust your gut. But learning to trust your gut is really a compilation of data that you've acquired over the years and then have either proven or disproven that what your gut is telling you is true. But I think it is important, as Josh said, that even as a trained clinician, I have a pretty highly tuned gut response. Frequently I'm wrong, and we need to really be aware of that. Or in a setting where I think might be dangerous, sometimes adrenaline and other things can influence that, and you're actually making a really poor judgment based on gut and based on fear. So although we want to put this caveat in that particularly in terms of human interactions or sometimes adrenaline-filled split-second decisions, you don't really have time to analyze all the data. Ideally, in most circumstances, you do want to slow down and analyze the available information that you have. And not trust your gut when it comes to things like service utilization data Or are we more or less productive? Those would not typically be areas where we say, just trust your gut.
And this is really what's interesting, is when you think about most business-related, operations-related decisions that you make on a day-to-day basis as part of your organization, they don't really fall into these categories. Mm-hmm. And yet people continually go back to sort of gut-based decision-making because it's what comes most naturally.
Right.
Finally, the last group of biases that we wanted to talk through is what we're calling herd biases. And many times this really just boils down to the misconception that having agreement around a decision that's being made means that it's a good decision. There are lots of reasons why we fall into this trap, but so some of them would be that we follow the person with the highest status in the room, right? So whatever the leader says, nobody wants to disagree with the leader, even though many times the leader really wants, somebody else to offer an alternative point of view. We follow the hippo. Hippo here standing for highest paid person in the organization.
And sometimes you'll see this not necessarily in the formal leader, but in any group. There's typically a person or two in the room that when a new bit of information gets put on the table or discussed, all eyes kind of naturally turn to a person or two, kind of maybe the more dominant personality in the room. It's just a very common thing in group behavior. Not always the actual leader, but within any group, there's kind of that informal leader. And so then the group tends to follow that, kind of reinforces that, yes, we all agree, we all think this is a good decision, but frequently not based on fact or data or information. It's really just based on that person's reaction and maybe a fairly compelling verbal response.
Yeah, absolutely. And what that sort of leads to is, so you get these sort of cascades, or like what I call here dominoes, where, how many people have been in a room where somebody says, all right, so this is the idea on the table, let's go around the table and see if everybody agrees with this idea. Well, if you're the last person on the go-around and everybody else has agreed, how likely are you to disagree with the idea at that point? A lot of times, people engage in self-censorship for that reason or others, even though, and so some of this actually could call for a redesign of the way that we make decisions as groups. So something as simple as having people write down whether they agree or disagree for 5 minutes, and their rationale for 5 minutes before that discussion takes place would change the dynamic of the sort of dominoes falling into agreement, and I think allow for a more rich exchange of ideas.
Right.
So with those biases, now that we know what those biases are, we can sort of try to guard against those as we work toward our ultimate goal here, which is making good decisions for the people who your business serves and for your business, the business itself, as well as those who work there. So here are the parts and pieces of a good decision. We'll go through each of these. All of these are really necessary. Like, you can't just skip over one step and still have a good decision. Every single piece here needs to be evaluated to really have a high level of quality in the decisions that you're making.
Yeah, in fact, some of the research that we were looking at talked about if you're like at 90 to 100% solid on 5 of these, and really only 20% solid, for example, on really exploring your viable choices, the quality of your decision defaults to the lowest common denominator. Yeah. So it's really only 20% of a good decision. It's not like you can just average these out and say, well, we were 90% solid on 6 of these elements of good decision and 20% bad on 1. So it averages out to like 85%. It's just not the way this works. So we really do want to think through each of these elements and again kind of give you a framework as you sit in committee meetings, as you listen to decisions being made in your organization. Maybe listen for what might be missing from making a good decision.
So rather than giving sort of detached definitions of each of these particular elements of a good decision, we thought we would actually tie it to a specific question and situation that was brought up at one of the last data labs that we had. So here is the question, or one of the several questions that came up at the last data lab that we encountered. So the question was, do we have low utilizers of the specialty behavioral health system in our catchment area, CMH, who can be moved on to a community provider? So let's walk through all of the elements of a good decision and sort of see what we mean by each of them by answering some of these questions, right? So if we're talking about context, what's the context for this question?
This one was interesting for me because when I first heard the question, my context for low utilizers has always been someone who needs more service. Like in a utilization management framework, when I heard the phrase low utilizers, I immediately thought people who are underserved by our system and need more. Where in fact the person asking the question was using the term low utilizers to mean, really we have limited capacity. There's not a lot of doctors, there's not a lot of psychiatrists available to us. We really want to maximize the use of our psychiatrists. We're maybe not sure what role we should take on for the mild to moderate population, but we know for some of those folks there might be a viable community provider that should or could provide that service. And so it was really more about effective use of public behavioral health care resources, very different context. And it was important for us to really flesh that out as this person asked that question. The context from which they were bringing the question needed to be clarified so we understood what question was being asked.
Yeah, and a lot of times we think that our questions make a lot of sense because we've been thinking about them for a while, right? Like I'm walking around carrying around these questions in my head. So it's sometimes surprising to me that somebody else doesn't immediately understand the context, but it's crucial that we walk through and we make sure that we really understand each other. I mean, a lot of what this is about, especially in the context of group decision-making, is making sure that we understand each other and our joint reasoning for a decision that's going to be made.
Right. So one of the ways to get at that would be to ask more questions about the context from which someone's asking a question.
Yep.
So if this is occurring in a utilization management team, or if this is occurring because there's grant opportunities, what's the context that the question is being asked from? And is it a context of we want to build a new program? Is it a context from limited resources and best use of dollars? Is it in a clinical context where we want to look for the best and most effective clinical program? Really understanding terminology and context is really critical.
The next thing that a good decision needs is choices. I mean, if there's only one thing up for discussion, then really there's a decision, but the decision is really yes and no. The more choices that we can bring as possible alternatives to a specific question and decision point, the better, right? So by the competition that takes place amongst those different alternatives, any given alternative gets stronger because it's considered against other possibilities. So here, for instance, so some of the options or ways to address or make a decision based on this question would be, all right, we could either add capacity to the current model of doing things to support these low utilizers while continuing to serve them. We could refer to a community provider. We could build a new model where we're serving them in a different way, or like we're enlisting technology and monitoring to do sort of really low-touch services that still involves keeping them connected in case of a future crisis. Or we could do nothing. I mean, that's always one of the choices. I mean, the status quo is a choice, even if we continue to make it day by day.
Right. So I think this is a great example of a person framing a question, and you always want to make sure that you value that person asking, kind of putting yourself out there and asking the question. But sometimes in the question there is an inherent solution, and you want to be careful of that bias to immediately assume that that's the right question to be asking. So exploring viable choices allows you to say, okay, moving to a community provider is one choice. What other options, what other viable options do we have? If in fact we find that we have folks that are very low utilizers of our system, for example.
Also, we need reliable data, which means meaningful data. And we'll get into this in a little bit greater detail later when we talk about formulating a specific question to ask using the data. But this was another thing that we did as part of that data lab, where really we're going through in detail and making sure that the question is being answered exactly by the data, or that we're clear on the limitations of that data.
Mm-hmm. So I think also on that reliable data piece is really to be able to define terms, and we're going to get into that in a minute, and not make assumptions about the terms that folks use. So the values and trade-offs thing, I think, links right back to the viable choices. In order to consider whether or not a particular choice is viable or not, you have to think about, well, what are the trade-offs? If we make a particular choice, what are we giving up? If we push on one lever, what's the reaction or response or impact on a different set? So assuming we said move to a community provider, that could result in then losing quote-unquote control or that therapeutic relationship that's actually preventing a higher cost, high-risk situation. That's a trade-off to kind of giving up a treatment relationship. You might lose the ability to prevent a crisis, theoretically.
Yeah, and those trade-offs, so this is really a place where eventually, if you're starting to look at statistical models or to actually to try to understand the implications potentially of different choices that you might make, this is a way to use data to say, all right, if we decreased something over here by this much, would that have a corresponding impact in this area? And to try to think through, not just sort of guesstimating, but think through in a really logical way what the impacts of that would be. And that's really what the next step is, which is tracing the logic of those potential choices that you've listed against the trade-offs that you've identified using the data that you have.
Right. And in some really complex decisions, you might actually apply weight to values, for example. Like this might be in some ways a poor business decision, but it's very consistent with our values, so we're going to take a loss on something. A very intentional decision based on that filtering through the trade-offs, the values, what we're trying to accomplish, and recognizing the implications of decisions.
Yeah, and there are all sorts of methods that have been developed for making these sorts of really complicated decisions, even decisions based on values, in a structured way that doesn't end up sort of defaulting to... It feels right? Right, it feels right, or we just talked about this for 2 hours, I'm just going to make the last decision that we talked about.
Right.
You know, I mean, because these are really complicated issues, like we've said before. But methods exist. People have thought through a lot of this, and there are some decent methods for making these sorts of decisions. And finally, critical, but sometimes forgotten, is commitment to act. And a really important question here is just making sure that we define who exactly has to commit to act. Because it's not just one person. It's anybody who's accountable, anybody whose involvement is necessary for the change to be successful. And as a part of making a good decision, it's worth listing out those people and making sure that there's a plan for communicating the decision if they weren't there for the decision to be made, and for getting their commitment to act and follow through on the decision that was made.
And I think this is particularly true now that we have access to so much more data than we used to have related to people's healthcare conditions, related to service utilization. Tying it back to this data analysis project, people are going to tend to just get really curious about a lot of data. And for a while, I think that's an okay stage to be in. We do want people to be curious. We want to have them get exposure to this new data set. But we really do want people to move along on a continuum so that at some point, if I say to Josh, I'm really curious about X, Y, and Z, that he would be able to say to me, what would you do with that information if I made that available to you?
You sound like I've said that before.
Perhaps that's a familiar statement. So, and again, I think you have to consider this in your own organization and the culture of an organization, because you do first want curiosity. We do want people to be exposed to the data sets. We want to start producing reports and analysis that you find interesting to get other people interested in the data. That's the first stage of this, is just interest and curiosity about the data. But nothing changes just by saying, that's really interesting. So this question of, well, if I gave it to you, what group would look at it? What group might be responsible? What action might we take if we had a significant finding? And we could answer this question using data.
So now we're going to look at just some of the basic tools, especially for the part of that last section that related to reliable data. And we're going to talk about it in two levels, I guess. So the first one being a personal level, and the second one being an organizational level. And unbeknownst to us, so while we may react in a way we're skeptical of information as it's used at an organizational level sometimes, especially if that information doesn't fit with sort of our view of the world, we're actually pretty good at using information in our personal lives. So for anyone who has a car, you have the experience of responding to data that's being collected and presented to you every single time you drive that car. When you slow down, when you see a cop in the median of the expressway, when you are accelerating up to a certain speed, etc. Like, you have a dashboard that tells you exactly how you're doing in multiple areas as part of driving that car. Similarly, for anybody who's ever been on a diet, counting calories and sort of keeping a running list of those, and that's a place where a lot of times manual data collection is happening for you to meet a personal goal. And then finally, for anybody who, like myself, owns a Fitbit or some other sort of wearable device that tracks steps and other metrics throughout the day, I mean, people are more and more using wearable devices that collect their data and then give it back to them in a way that can help them to modify the choices that they're making, right? So if I have a goal of going 10,000 steps per day, I know when it's getting close to evening whether or not I'm on track to meet that goal, and whether I should go out for a walk or not. And that feedback is part of how I personally, at least, use data on a day-to-day basis.
And I think the important thing that you're talking about there is that ideally that feedback is immediate, or as close to immediate as it can be. So we've all kind of heard stories of, in fact, I heard a friend say this the other day. She's been doing Weight Watchers. She hadn't really been tracking her calories because she kind of thought that she knew the routine. Like, she was now aware of foods that were healthier or lower in calories, and she went to the next Weight Watchers meeting feeling like she had lost weight because her perception was she had been doing some things right, and got to the meeting and the scale doesn't lie. So she immediately went back to, you know what, I have to count it every day. I have to use the tools. I need that immediate feedback of daily counting or daily counting steps or whatever. The more immediate the feedback, the more likely it is to change a behavior. Otherwise, we default to some of those biases, like, I feel lighter today, or these pants seem to fit better today,
right,
which is a really unreliable way to measure weight.
Yes. So the tools that we have, so the organizational ones are ones that everyone is really fairly familiar with. So we look at dollars to measure to measure whether or not we are keeping track of available resources and using those in a way that's sustainable. We look at quality measures to see whether we are in fact producing value in the lives of people that we're serving, etc. So all of these are sort of organizational metrics that are a compilation, really, of measures around individual personal performance aggregated to the level of the whole organization.
And I think that even in the organizational level, the more you can provide, quote-unquote, real-time dashboards about performance, the quicker you can make course correction, the better decisions you'll make, rather than waiting for month or quarter to end and look back retrospectively on performance. So we really are talking about increasing use of whatever data we have available that might change behavior kind of in that moment, using data to do course correction while you're in the midst of behaviors, rather than always looking at data retrospectively.
Yeah, and the data that is available to you in your personal life is really, I mean, we're sort of in an ideal situation to test things out in our personal life before we implement them at an organizational level, right? Like, we all have opportunities to use data and to change the way that we behave, or, you know, what we're doing on a day-to-day basis based on the data that we're collecting. So if I know that I'm never meeting my running goal, but I never do anything to change that, why would I think that I'm likely to listen to data in an organizational context? Right? So there are all sorts of individual and then collective group disciplines to actually make this work and to turn those facts into a change.
And active feedback mechanisms.
Yeah. So the tools that we have at our disposal are three pretty basic tools. And we're talking about tools here not in the context of technology. So technology really enables and propels each of these potential tools, but these could be on paper. And in fact, they have been for, you know, most of the time that they've been being used. So a process. Airlines are particularly good at this, right? So another book plug, if there's anybody who hasn't read it, Atul Gawande's Checklist Manifesto is a wonderful book. And I think in a subsequent article, he actually talks about there was this airline crash in, I think it was like 2009, where an airliner landed safely on the Hudson River. And the pilot was sort of brought in for, I mean, all these interviews. The pilot was sort of widely lauded as a hero. And what the pilot continually said in those interviews is, well, we had manuals to help us through all of this. Like, that really, I was just doing what I was trained to do.
It wasn't gut instinct. It wasn't just amazing physical performance.
Not at all.
It was actually a manualized process for very quick decision making.
Yes. And in fact, I mean, those processes, I think a lot of times why we don't want to follow processes, why we want to believe that it was the pilot, is we have this sort of view of heroes as, like, a hero is the lone person who follows their gut, makes a decision, and everything works out. Whereas in this case, the heroes are really the engineers who developed this process through painstaking testing and repetition, and who made a process that this pilot, even when he was at risk of dying, felt safe enough to follow those and overrode his own worry and fear in order to follow those processes.
Right. I think that's interesting, too, that we actually really appreciate these processes in other people. People who follow process, like a doctor counting instruments before they close up and suture someone during surgery.
Yes.
We appreciate checklists and really good process in other people, and don't always recognize the value of those processes in our own work.
Yeah, absolutely. And I think that this is a place where it's very difficult to follow processes because it's referring to something outside of yourself, right? So it certainly takes some getting used to, but process is one of the key tools. I mean, it's really how research gets brought from the realm of sort of an academic institution into practice and practical application on a day-to-day basis. Next, we have data. So we're collecting data all the time, and like Laura said, needing to repurpose that data in order to use it effectively as a tool. And then lastly, communication. So communication is a huge tool, making sure that we're actually coordinating care between different entities, that we're doing handoffs and communicating needs that a consumer has when they're going from one setting to another. All of these things are tools that are necessary to drive better performance.
And just another example of that, communication being that tool that it's that essentially that what you measure, you know, people pay attention to what gets measured, and what gets measured actually changes. And that doesn't have to be public humiliation or public shaming about performance. It can be simply communicating data in a way that everybody can see. So, you know, examples of just putting productivity up in a public place without names, without identifying information, can actually change productivity in an organization. Communicating that we're measuring something can actually change behavior.
Yep. All right, so those are our tools. And now we're getting to sort of how we specifically do this. So this art of asking questions can involve going and looking at research and determining processes. It can involve coming up with queries related to data, et cetera. And these are really, so we tried to boil down the steps that we go through, or the steps that we see other people go through when they're really asking good questions, and to boil those down into, 3 basic steps. And I think most of the really great questions that I see on an ongoing basis have these 3 parts to them, right? So they have, first of all, and this is something that Laura just brought up, right? A curiosity about them. They have, it's not like a person was just sort of walking blindly around the world and then data came and sort of smacked them upside the head and told them to notice something. You have to be curious. You have to look for patterns, look for the ways that change happens from one month to another. Also look at things that are stable, that are maybe you thought were foregone conclusions, that something should always be this way, but that really it doesn't make sense that it necessarily has to be that way. And that's not something that you can necessarily apply as an algorithm. It takes some amount of human curiosity and noticing of patterns.
And I think that some people are naturally curious, and others need to have that curiosity brought out or kind of recognized. So what I've learned is that frequently in meetings you will hear language that should trigger, this person's really curious about something. They may not have the question perfectly formulated, but they're saying things like, I wonder, or I wonder what those folks have in common. I wonder what we could do about that. That's a really tough problem. We've got a situation here, like really trying to be in tune to people who are using that language, and then to be able to say, I'm going to jot that down, and either in that meeting or after the meeting, learn more about that curiosity in that person. What is it that you're really curious about? Would you actually like to see if we can find data related to that, or are you kind of content with wondering? And some folks really are content with the wondering, but I think we're trying to promote cultures that say, well, let's start answering with data some of those curious questions.
So once we have noticed something, right? Once we've actually found a question, found something that sort of, prompts us to look a little bit deeper, we want to relate it to an issue, right? So there's no question that's just important, like does a tree that falls in the middle of the woods make a sound? Like there's no question that's important without the context of people. So questions have to be related to a specific context, to a specific person or set of people, and ultimately they have to sort of pose a problem around which a decision has to be made.
And I think even a null hypothesis, you hear someone make an assumption about something, to retrain your ears to say, well, they're making a pretty strong statement, but in my mind as a data analyst, I'm going to think that's actually just a hypothesis, and I'm going to see if I can prove that with data or not. That's just a fun exercise for those of you who are just starting to use data and use this data set. Listen for strong statements in meetings that don't immediately have data behind them, and use that as your null hypothesis and say, well, is that true? I'm going to assume yes, and then look for the data to verify that.
Yep.
And really think of all of those strong statements still as questions.
Yeah, absolutely. And so these are just the basic elements of a problem statement. So if we're trying to make something relatable, we're trying to say, all right, this thing that we noticed, how does that actually relate to a specific circumstance? These are the questions that we're asking. What's the problem? Who does it affect? How does it affect them? And what's the actual decision that needs to be made? Because all real questions, all real problems have a point of decision that they have to drive towards. Because otherwise it's curiosity, or it's actually just, it gets to be kind of hopeless if you have no decision or choice to get out of the current situation and address that in some way.
Right, then you'll get charts and graphs that people say, that's really pretty.
Yes.
Which is not the answer or the response that you're actually looking for.
And
not that that's ever happened.
No. So lastly, we have formulating, and this is actually what we spend a good deal of time on in data labs. For those of you who haven't had a chance to attend one of those yet, In this last step, we're looking at formulating a question, and that's turning the problem statement into a very specific question. So we're actually taking it as a sentence, and most times we write it out as a sentence, and we say, okay, so this is your question. Now let's take all of the parts of speech, let's take all the pieces and parts of this, and make sure that we have a clear definition of what we mean, right? So back to the example that we used previously, with the question, do we have low utilizers? We have to define low utilizers. We have to define can be moved, right? So low utilizers, and then can be moved, we found out means a low risk of needing, let's say, like inpatient or other crisis services in the near future, right? So that has its own definition built into it.
So low utilizers of what?
Yeah.
How do you define low? How do you define who could be moved?
And even things that you think are sort of a foregone conclusion, like we, right? So all of this differentiation as a whole doesn't mean a specific program, doesn't mean only people who are case managed. All these things, a lot of times people sort of have an expectation in their heads that other people share the same definitions that they have, but that's not necessarily true.
Mm-hmm.
So thank you for spending your lunch hour with us.
Mm-hmm.
We wanted to encourage you, as we're sort of sending everyone back off into the world of meetings and decision making, to please try this at home.
Mm-hmm. And if you're struggling with like, when I try to drill down into some of those statements, it's not always well received, that's okay. I think those would be perfect applications to bring back to Data Lab to say, well, I just jotted down a few curious things I heard in a meeting. It seems like people might be interested in that. And we can together in a Data Lab formulate that into a question and think about how we could put data around a set of questions. And you might bring it back to the person who seemed curious, and they may say, that's not at all what I was interested in, but that's the beginning of a dialogue. So we would really encourage you to really listen in those meetings in the context that you're sitting in already, and listen with the lens that we've described today. For those, listen for decision biases, listen for curious people, and bring some of those ideas to the next Data Lab.
Thank you all for listening, and we hope to see and hear from you all soon. Have a great afternoon, everybody.
Thanks.